Let's bring you the news updates at this time. Borno State Governor Babagana Zulum has denied being aware of the reported appointment of a governor over some territories in Borno State by Boko Haram and Islamic State of West African Province. Governor Zulum, who dismissed the claim as not being substantiated, insists he remains fully in charge of his state and is not investigating the matter. He made these assertions while speaking with State House correspondents after meeting with President Muhammadu Buhari at the presidential villa, Abuja. The governor is more concerned with how to repatriate the over 200,000 Borno indigents who fled the insurgency to Chad, Cameroon and Niger Republic and was at the presidential villa to seek the president's assistance.
These people of Borno State that are taking refuge in our neighboring countries are willing to return home. And therefore, Borno State government has fixed a date of 27th of November 2021 for the commencement of the repatriation process, especially to local government areas of Abadam and Kuzamala. There is no any region or portion in Borno State that you can term it as under the insurgents. But the insurgents is not over. We're battling with them, and then, but their menace has been reduced. We're looking forward to see how we can completely degrade them. You know, such dimensions of insurgency will take a longer period before somebody will say that the insurgents are completely eliminated.
The kidnapped Emir of Kano, Al-Hassan Adamu, has regained his freedom, authorities confirmed to journalists on Monday. Earlier, the abductors demanded 200 million naira ransom, but it cannot be confirmed whether the money was paid for his release. The Emir was released at about 5 p.m. on Monday after spending a night in the custody of the bandits. However, 13 other members of his family are still in captivity. Confirming his release, the spokesman of the Abuja Area Council, Dahiru Abubakar, says the Emir was released at an undisclosed location within Kajuru local government area and in good condition. The monarch was kidnapped by bandits in the wee hours of Sunday along with 13 of his family members, including 2 grandchildren. The governors of Cross River and Zamfara State who recently defected to the All Progressives Congress have been officially presented to President Muhammadu Buhari. The new APC members, Governors Ben Ayade and Bello Matawali, were accompanied to the event by the Chairman Caretaker Committee of the party, Governor Mai Malabuni, Kebbi State Governor Atiku Bagudu, and Jigawa State Governor Muhammad Badaru Abubakar. President Buhari, who handed the flags of the party to the 2 governors, commended them for having the courage to leave their constituencies. The caretaker chairman of the APC, Governor Mai Malabuni, used the opportunity to explain that ward, local government and state congresses of the party were shifted for 1 week because the initial dates clashed with Salah festivities. The primaries are now expected to start July the 31st.
We want to demonstrate to our people and to the rest of the world that we respect our individuals, no matter how lowly in the society. That was why we emphasize the fact that we respect our people, no matter how low. This was why we emphasize free, fair elections.
Copies of our nomination forms for the congresses, starting with the wards congresses, the local government congresses, the state government congresses, for the commencement of the congresses on the 31st of this month. It was shifted a week because of the Salah, which coincided with the earlier 24th. That was supposed to start on 24th, which will now start on the 31st of this month, election.
A federal high court in Abuja has threatened to issue a bench warrant of arrest on former aviation minister Stella Oduah over her continuous absence in court. Justice Inyangekwo issued the threat on Monday following the refusal of the former minister to honor court proceedings. The Economic and Financial Crimes Commission is alleging that she misappropriated public funds while serving as a minister. Now a senator representing Anambra North Senatorial District in the National Assembly, Ms. Oduah, was bailed to be arraigned on a 25-count alongside 4 others. They are charged with conspiracy and money laundering, as well as maintaining anonymous bank accounts. Resource mobilization and building capacity to stem the tide of corruption in Nigeria is on the front burner of discussions at the launch of the Abuja Municipal Area Council Anti-Corruption Strategy and Action Plan. The one-year plan is expected to help guide and promote civil society engagement, public service, and anti-corruption agency participation in the fight against corruption. Kemi Balogun reports.
Since 2015, the fight against corruption has been a constant for this present administration. Yet, in the most recent Corruption Perception Index, Nigeria's 2020 rating by Transparency International stood at 25 points out of 100, making the country rank 149 out of 180 countries. Due to this, the Abuja Area Council, with help from civil society, is working to find practical solutions towards confronting this growing monster through the launch of the Anti-Corruption Strategy and Action Plan of 2021 to 2022.
Since our coming into office, we've been trying to see how best we can, stem the tide by, reducing the ugly trend in the society, which is corruption, that is killing everyone, and militating against, of course, delivery of service to the people.
There are challenges, right, because of sometimes the fact that there's not much attention that is paid to the area council. Most of the calls for transparency and accountability are at the state level or even the federal level, but not too many people hold the area council accountable. So because of that, there are a lot of things that have been happening that people don't know about. The idea of this was to be able to pull out and identify those areas and then work with AMAC to see how we can provide solutions to change those things. So what are some steps, what are some actions that can be taken to reduce the level or the vulnerability to corruption for those particular services?
The push is to introduce better transparency and accountability parameters and systems in order to curtail all forms of corruption, including within the civil service.
Civil society organization must work closely with champions in government to identify the civil servants that are undermining the rule of law and democratic principles while propagating corruption, and ensure that they're prosecuted and put behind bars. I believe if we show example with these people, other civil servants would learn from this trade and do good rather than continue to do bad.
Although some strides have been made in the fight against corruption, experts still say it remains one of the main spoilers of Nigeria achieving the 2030 agenda for the society.
Now, there is a surge in the number of COVID-19 cases, with the Lagos state government saying that a third wave of the pandemic may be imminent. NCDC, the Nigeria Center for Disease Control, on Monday reported 161 new cases of COVID-19, taking the total number of confirmed cases to 168,713. Lagos recorded the highest number of cases with 153 new infections. The Federal Capital Territory recorded 4 cases, Gombe 2 cases, while Oyo and Rivers State recorded 1 case each. So far, 164,476 people have been discharged, while 2,124 people have died from COVID-19 related complications. Health authorities are appealing to Nigerians not to let their guard down, as Nigeria records its first cases of the most transmissible Delta variant of COVID-19. Already 2 persons have lost their lives to the Delta variant of COVID-19 in Oyo State. That's according to the state's incident manager and coordinator of the Emergency Operations Center, Olabode Ladipo. But for many Nigerians, disbelief is rife and precautionary measures are being disregarded in public places. Joining me to discuss this is the Secretary, Nigeria Medical Association, Lagos State, Dr. Emir of Kano. Good morning. Thank you for joining us.
Thank you for having me.
Now, despite the protocols put in place by the government, especially at the point of entry, especially at the airports, we still saw the Delta variant slip into the country somehow. But that's not the case. My question is, what concerns do you have now that we have this variant in the country?
Yeah, thank you for this. It's important that we draw the attention of the populace. Just like you mentioned, the disbelief is still there. The doubts are still there. The myths are flying up and down, even with vaccination. You saw the magnetic thing and all that, you know. So, and when Mr. Governor was giving his statement on Sunday, he mentioned how some people even try to escape the normal screening that they're supposed to do at the airport. So this is quite worrisome. Now the Delta variant is in town. It is highly transmissible and it's very virulent. And its symptoms are not so, like there is no fever, there is no cough. So it gives myalgia, like body pains, weakness, and all that. That looks like the malaria. You remember, even with the time that we had so many cases, some people were comparing. We say, is it not just malaria? Do you understand? So this one now sounds more like that malaria, and the chances are very high that people are still going to push it aside and be like, they have come again. It's just malaria.
We still see people saying they have come again. I mean, we had a guest yesterday that I was speaking with, and he was like, government said, that's what government is saying. And I was asking him, don't you believe the government that this variant is here?
No,
and
they don't.
It is like, no. And then you go on social media. He didn't point blankly say no, but then his body language seemed like he didn't believe. Then you go on social media, you see people saying it is a lie. Now, how do we deal with this situation where people are still struggling to trust government? The strings, how do we pull the strings of trust together at this point where we know that this virulent or common enemy is here and we need everyone or every hands on deck to address this issue?
Okay, so our routine methods of passing information, sensitization, and creating awareness, public health enlightenment, we're still going to go and, like you said, pull the strings together, because apparently they were a bit relaxed, because at some point, you know, we used to have 3-digit figures when new cases. Then at some point, we're almost getting to 1 digit. There was a time we were having 20, 12, you know, but towards the end of June, we're now having, like yesterday now, Lagos alone had 153. I mean, wow, it's been a long time we had such a surge. So we need to go back to our religious leaders, our community leaders, those people that can speak and people will believe. There are some things that I may tell my client as a doctor, and he may he won't, just like you said, the body language will tell you one of those things, but I've heard you, and he will go away. But when a religious leader is saying it, and you trust us now in Nigeria, we're very spiritual and very religious.
Absolutely.
My pastor said, my GO said, my imam said. So we need to go back to those people, those gatekeepers, those influencers, and go through them again and pass this message. I think it's better for us to err on the side of caution. So, I mean, it doesn't hurt anybody to wash your hands, doesn't hurt anybody to mask up, it doesn't hurt anybody to keep the distance. So even if they don't believe that the surge is here, the third wave is almost imminent, but at least if we do this, it's just cleanliness, if you ask me. So we're still going to go back through those routes and see how we can get back to our people. I don't know how we can gain their trust when it comes to government, but it has affected all spheres of life, and now it's affecting our health.
According to reports, Dr. Okon, there's been talks about the fact that this variant, that's the Delta variant, is slightly resistant to the vaccine we have seen on the ground, because a lot of persons believe that if we vaccinate, that we'll be able to, and we are able to get that herd immunity, we wouldn't have as much impact with regards to the Delta variant. But with reports saying that it is a little resistant, where does this leave us?
We cannot underestimate the role of vaccination in preventing diseases. So even in this case, if you're vaccinated, you are going to be able to protect yourself. Even if you come in contact with this Delta variant, the symptoms are not going to be as severe as if you are not vaccinated. And this brings me to the second dose this was mentioned too, the coverage for the second dose is so low.
1%.
1%, abysmally low. So with the AstraZeneca vaccine, you're supposed to take 2 doses. 1 dose does not protect. So we had a high coverage with the first dose. People were very excited, but I don't know what's happening with the second dose. So I hope people are aware that it's not Johnson & Johnson that is just 1 dose. It's not like that one. You need to get this second dose to be protected. So I'd like to encourage those that have not had their second shots to do so, because you still cannot remove the fact that vaccinations are protective.
As it stands with the Delta variant. But then let's talk about vaccine hesitancy and the disinformation that we are getting. How is that impacting this vaccination, and how can we counter it? What are we doing? Efforts put in place by Lagos State government, for instance.
Yeah. We keep talking, we keep emphasizing, we keep sensitizing, creating awareness, meeting with individual groups, bodies, and talking to them about this vaccination, because this misinformation, it's for real. And it's having adverse effects, because that's one of the things that will make somebody that had the courage to take the first dose not to go back for the second one. So it's really affecting, and it's increasing this hesitancy. But like we say, we won't stop talking, we won't keep emphasizing, we'll keep passing the information through all the means that we can. And the media has a role to help in disseminating this information too. So we just keep talking.
There is a concern that this Delta variant is targeted. That's the word some persons have used. But then the young people are susceptible to this variant. I want you to clear the air on that and help us better understand this Delta variant. You have talked to us about the symptoms, but then what makes it different from the others? During when we saw the first strain, we knew that a lot of the aged were said to be susceptible, and so the young people were excited that they were free from this contracting the virus. But now, as it is, the Delta variant is here. We have seen some school children in Ghana who have contracted the virus, and there are concerns that it seems to be focusing on young persons, and that is where our population, we know that young people make about 70% of our population. How much of a concern is this, and then help us better understand this Delta variant?
Okay, so before the Delta variant came, which is just a very recent thing, you would recall that even during the time we had the second wave towards the end of last year, we were having younger people get susceptible or fall for the getting infected. Initially, the early part of 2020, we knew that because of reduced immunity in the aged, they were the ones that were adversely affected most. But towards the end, we started seeing the young people. So, and even in this case of the Delta variant, the word targeted is not, I know you are just using the word, but it's not targeted. I think it's just a call for everybody to stick or adhere to these precautions, because it is not just the elderly. Even when we were emphasizing that the elderly are the ones that are prone to have severe cases and all that, but the younger ones are the ones that get the infection, take it home to these elderly people that even are home. So I think it just calls for precaution across board, whether the young, the old, middle age. So we just need to adhere to these protocols.
Talking about adhering to protocols and measures that can be put in place, WHO has always said that government should show leadership when it comes to managing this issue of COVID-19. As it stands now, we have talked about the trust deficit and perhaps how government can address it. How can government, show leadership at this point? Because everybody seems to be fatigued. And so we have dropped the ball, let our guards down. But right now we have a common enemy staring us in the face. We need to address it. All hands on deck is what it is now. How should governments, lead from the front? Because we have seen the case in Oyo State now. And we said, according to reports, 2 persons have died. What should government be doing at this time, especially not just to protect the people, but doctors like you as well, which was a major concern during the first and second wave?
Okay, so the first thing is, as we have said, all of us have relaxed, and enforcement has relaxed too. So we need to spice up, if I use that word. I don't want to use strong words. We need to enforce the rules. We've said in gatherings where you have congregate settings, you shouldn't have more than 50% occupancy. We need to. At one point, people were scared. When you go to churches, the pastor will be, no, we are too many. I think some people have to go home because I don't want anybody coming to my church, get embarrassed and all that. But we have relaxed on that because the people that are enforcing to were not to, and especially I think because the cases were going down. So we need to jack this up a little bit more. And the vaccines, for now, we do not have. We've stopped for now. So even while we are trying to encourage people to take the vaccination, government has to make sure it is available and is accessible. These are the things that they have to do, being at the forefront. Enforcement of those of adherence to the protocols, and making sure the vaccination, which is a preventive strategy, is available and accessible to all.
Now we're talking about ensuring that perhaps we're looking at interstate travel. That's what some persons are saying. What measures we can put in place. Well, as it is now, we don't know what measures government will put in place with regards to international travel, now that we have the Delta variant. But are you confident that these measures, the surveillance measures we're putting in place, will be able to help us ensure that we do not have a slip again as to addressing issues of these cases coming into the country?
I'm sure that the government is actually in charge and in control, and especially the Lagos State government. We've done it before, and when we had the second wave, and I think we can do it again, because at some point the cases were coming down, and we can enforce those measures again, just like we did before. So I'm quite confident that these two will pass away.
Absolutely, we can always be confident that this too will pass. But then let's look at vaccination. There are those who are saying perhaps Nigeria should look at getting a license, because we have seen cases of vaccine nationalism. There are cases of those who are calling for, you see some African countries calling on richer countries to, invest in Africa, especially third world countries, developing countries, such with regards to issues of vaccination. But there are those who are saying, no, we shouldn't keep waiting. Let's get a license and, work on something monitored by the government, and then we can easily have access to vaccines. This will address this, because this may not be the last pandemic we may face. What do you say to this?
I totally agree. Nigeria is very rich and we are endowed. We have all the people and the capability to do this. So if we can work on this, it would definitely go a long way, and it would help us locally so that we have an increase in access to this vaccination.
How about collaboration amongst African countries? Is this something you think we can also look at?
Sure, and especially since we have the union, we can always work on that too.
But we are not seeing anything. Isn't that of concern to you? African countries saying, let's come together and have a conversation with regards to developing something ourselves instead of waiting for handouts.
We always start from a point. So now that the idea has come, I'm sure our leaders are going to come, and we have experts that are going to discuss, and maybe by the time they present the position papers and all that, these talks will start, and something will be done.
How challenging is it to get when we talk about a license for a vaccine? Talk to us on that aspect. Do you know how challenging is it, or is it as easy? Because for this aspect now, we are seeing that getting a vaccine, there are talks that we still have to go through a process that might take a longer time, seeing how virulent this Delta variant is.
Yeah, it's not quite an easy process. So, but like I said, it's something that is worth the try. And while we're at it, we'll still continue to do what we're doing. It's not that easy to get the license, but it's a doable thing and it can be worked on.
Your final word to Nigerians on COVID-19?
While we are doing our best, government is going to do its best, but we as individuals, we need to do what we need to do. Let us continue to adhere to the protocols, mask up, keep the space, and sanitize.
Very important. Thank you, Secretary, Nigeria Medical Association, Lagos State, Dr. Emir of Kano, for your time on the program.
Thank you.